Be ready 5 seconds.
In a democracy, people expect the government to work for their welfare. This could be through the provision of education, health, employment, housing, or the development of roads, electricity. We can think of health in many ways. Health means our ability to remain free of illness and injuries. But health isn't only about disease. Apart from disease, we need to think of other factors that affect our health. For example, if people get clean drinking water or a pollution free environment, they are likely to be healthy. On the other hand, if people do not get adequate food to eat or have to live in cramped conditions, they will be prone to illness. All of us would like to be active and in good spirits in whatever we may be doing. It isn't healthy to be dull, inactive, anxious, or scared for long stretches of time. We all need to be without mental strain. All of these various aspects of our lives are a part of health. In order to prevent and treat illness, we need appropriate healthcare facilities such as health centers, hospitals, laboratories for testing, ambulance services, blood banks that can provide required care and services that patients need. In order to run such facilities, we need health workers, nurses, qualified doctors, and other health professionals who can advise, diagnose, and treat illnesses. We also need medicines and equipment necessary for treating patients. These facilities are required to take care of us. India has a large number of doctors, clinics, and hospitals. The country also has considerable experience and knowledge in running a public healthcare system. This is a system of hospitals and health centers run by the government. It has the ability to look after the health of a large section of its population scattered over hundreds of thousands of villages. Moreover, there has been a phenomenal advancement in medical sciences whereby many new technologies and treatment procedures are available in the country. However, with all the positive developments, we are not able to provide proper healthcare facilities to people. This is the paradox, something that is contrary to what we would expect. Our country has the money, knowledge, and people with experience, but cannot make the necessary healthcare available to all. The public health service is a chain of health centers and hospitals run by the government. They are linked together so that they cover both rural and urban areas and can also provide treatment to all kinds of problems from common illnesses to special services. At the village level, there are health centers where there is usually a nurse and a village health worker. They are trained in dealing with common illnesses and work under the supervision of doctors at the primary health center. Such a center covers many villages in a rural area. At the district level, is the district hospital that also supervises all the health centers. Large cities have many government hospitals. The health service is called public for many reasons. In order to fulfill its commitment of providing health care to all citizens, the government has established these hospitals and health centers. Also, the resources needed to run these services are obtained from the money that we, the public, pay to the government as taxes. Hence, such facilities are meant for everyone. One of the most important aspects of the public health system is that it is meant to provide quality health care services either free or at a low cost so that even the poor can seek treatment. Another important function of public health is to take action to prevent the spread of diseases such as TB, malaria, jaundice. This has to be organized by the government with the participation of people. Otherwise, it is not effective. For example, when taking up a campaign to see that mosquitoes do not breed in water coolers and rooftops, this has to be done for all houses in the area. According to our constitution, it is the primary duty of the government to ensure the welfare of the people and provide health care facilities to all. The government must safeguard the right to life of every person. If a hospital cannot provide timely medical treatment to a person, it means that this protection of life is not being given. Hospitals and medical staff must fulfill their duty of providing the necessary treatment. There is a wide range of private health facilities that exist in our country. A large number of doctors run their own private clinics. In the rural areas, one finds registered medical practitioners. Urban areas have a large number of doctors, many of them providing specialized services. There are hospitals and nursing homes that are privately owned. There are many laboratories that do tests and offer special facilities such as ultrasound. There are also shops from where we buy medicines. As the name suggests, private health facilities are not owned or controlled by the government. Unlike the public health services, in private facilities, patients have to pay a lot of money for every service that they use. Today, the presence of private facilities can be seen all around. In fact, now there are large companies that run hospitals and some are engaged in manufacturing and selling medicines. Medical shops are found in every corner of the country. In India, we face a situation where private services are increasing but public services are not. What is then available to people are mainly private services. These are concentrated in urban areas. The cost of these services is rather high. Medicines are expensive. Many people cannot afford them or have to borrow money when there is an illness in the family. Some private services encourage incorrect practices to earn more. At times, inexpensive alternatives, though available, may not be used. In fact, barely 20% of the population can afford all the medicines that they require during an illness. Hence, even for those whom one might not think as being poor, medical expenses cause hardship.